right now. Listen, here's the protocol for the treatment. There is a protocol, and it should be followed to ensure that the treatment is effective. Small amounts of oil can be used to treat skin cancer and other conditions topically, or it can be vaporized and inhaled to help treat lung conditions. The oil is also used and absorbent to the body if used in the form of a suppository. Of course, it can be ingested directly by mouth. To treat internal cancer, the patient should ingest the oil as quickly as possible. In general, you will want to get this medication to the area that is causing the problem in the most sensible way. For example, if you are treating bowel cancer, the most effective means of treatment would likely be to take the oil in suppository form. The average patient can ingest a full 60-gram cancer treatment in about 60 to 90 days. People who have endured radiation and chemotherapy damage and patients who have suffered for years with MS and other serious conditions will find in some cases that the medical problems can take quite some time to heal. Those who have suffered serious damage, from the medical system or just starting treatment must realize that this natural oil does not produce an instant cure. Often such patients require much more oil and it will need to be taken over a longer period. Such patients should try to ingest 120 to 180 grams over a 6-month period to undo the harm and all the chemo, that the chemo and radiation has left behind, and repair the damage caused by other long-term illnesses of what is used to, from what is used to treat them. The medicines make you sick. Now, once the patient is cured and all of the damage has been undone and the condition is brought under control, Rick Simpson, he recommends that they continue to take a maintenance dose of 1 to 2 grams of oil per month, to maintain good health. So for an adult, it would equal about 1 little drop a day. And once they are all accustomed to it, and they do not feel the effects, you can, it's like, it's not a high price to pay for health, So maintenance doses just keep the cannabinoids in your body because they are missing. The first time we had them was from our mother's breast milk and starting to activate our immune systems. And then over time, we were supposed to eat them, and it only comes in 2 plants. Echinacea has a small amount of cannabinoids, and then you have cannabis, cannabism, the holy herb. It's even in the scripture. So 1 tiny drop, but the daily dosage though is 1 milliliter. 1 milliliter is about, if I was measuring it in volume, the tip of my finger, that volume from down there, but you can see it in a tube easily because that's where you can dispense your medicine easily. But people who have time, they start with a grain of rice, and not really time, but that their disease has not aggressively attacked them. But once you've been aggressively attacked, you need to start with the 1 meal, and the only way I know to get it in is through suppositories. So I have a video of me actually making that 1-to-1 mixture, because that's important to be able to measure it properly and to inject it properly, so that you can have to do it after you've cleared your bowels and you know that you don't have the urges, because you don't want to end up going to the restroom and release your medicine after you've taken it, because it's like $100 a day. So 60 days protocol is basically what it is, and usually people start by taking a little small amount, so 4 times a day until they build up, and then they start taking the 1 gram, and it takes about, after they build up, it takes them 60 to 90 days to do it. So that's like really what's going on, and I will just post that other video. And these people, the man with the pancreatic cancer, his medical records, the lung cancer, and his medical records, my partner Lee, who his cancer, prostate cancer, he had a PSA of 32, and he's perfect right now. So that's the name of the game.